My name is Dina and I'm going to be performing the insertion of the Foley Catherer skills video. I have no nails, no polish, or any jewelry on. I'm going to enter my patient's room, close the door or curtain to ensure patient privacy, perform hand hygiene, and introduce myself to my patient. Hello, my name is Dina and I'm going to be your nurse today. Can you please verify your name and date of birth? Okay, I'm going to check my patient's bracelet. Okay, Mrs. Smith, your doctor ordered a Foley catheter for you. Now what that is going to be is we're inserting a tube straight into your bladder that is going to drain your urine. Okay, do you have any questions for me? Okay, and I'm going to go ahead and apply my clean gloves. Going to make sure that my patient is lying flat. Mrs. Smith, if you could please bend your knees and open your legs into a butterfly position. I'm going to go ahead and get started with cleaning your perineal area first. Is that okay? Okay, so you're going to go ahead and feel my hand. And I'm going to clean using no rinse soap and water. Straight down the middle. I'm going to clean in the same direction and in the same order. Outer labia, inner, and then straight down the middle. Okay, now I'm going to inspect my patient's perineal area. I'm going to make sure that I can visually see the urinary meatus. I will check for any discharge or any foul odor. Okay, everything looks good. Now we're going to go ahead and get started. I'm going to perform hand hygiene. Okay, Mrs. Smith, we're going to go ahead and get started with your procedure. I am going to remove my sterile kit from my packaging. Please make sure that you do not move as I'm going to put it between your legs. Okay, I'm going to make sure that my patient's bed is elevated to a comfortable working height. I will open my packaging, only touching along the 1-inch borders. Okay, I'm going to position this. I will grab my sterile gloves. Okay, once my gloves are on, I'm going to go ahead and dispose of this. I'm going to go ahead and bring this a little bit closer to my patient. Okay, I'm going to go ahead and place a drape right underneath you, Mrs. Smith. If you can please raise your hips for me. Okay. Now I'm going to go ahead and drape your perineal area as well. Okay, now once that is set, I'm going to go ahead and start getting my supplies ready. Okay, now I'm going to remove my swabs. I'm going to open my lubricant. Then remove my Foley catheter. I will also apply the lubricant jelly to my Foley catheter. Then I'm going to ensure that I attach my sterile syringe into the balloon port. Okay, now once I have my supplies ready, I'm going to go ahead and walk you through this, Mrs. Smith. So first you're going to feel my hand, and I'm going to spread your labia open to make sure that I can visually see where your meatus is at. Okay, once I do that, now I'm going to go ahead and start cleaning, okay? I'm going to clean the outer labia. Now the labia closest to me. Straight down the meatus. And now I'm going to go ahead and grab my Foley catheter 2 to 3 inches below the lubricated tip. Now you're going to go ahead and take a deep breath for me. And on your exhale, I'm going to go ahead and insert the catheter. Please make sure you let me know if you feel any discomfort. I'm going to slowly start inserting. Okay, and I'm going to insert until I start seeing urine flow. Once I see urine flow, I'm going to advance about 2 inches more, and I'm going to go ahead and hold on to my tubing and start releasing the 10 milliliters of water. So this stir water is going to inflate the balloon to ensure that the catheter stays in place. Okay, now I'm going to go ahead and remove the syringe. Are you okay, Mrs. Smith? Okay, I'll remove that. Now I'm going to go ahead and hold on to my tubing, and I'm going to pull for resistance. Okay, make sure it's in place. Okay, now I'm going to go ahead and perform perineal care. I will go ahead and clean the outer labia, inner, and straight down the middle. I'll dispose of that. Now I'm going to go ahead and get rid of all these supplies. Get rid of all my supplies. Okay, Mrs. Smith, I'm going to go ahead and attach your tube onto your leg. I'm going to tape it there, and I'm going to hang your urine bag right here on the bed. Make sure that I do not attach it to any railings or anything that moves on the bed. Okay, now once I go ahead and do that, I will remove my gloves. I will perform hand hygiene. Okay, Mrs. Smith, are you in a comfortable position? Do you want to sit down or do you want to lay down? Okay, so my patient decided she wants to lay down. Mrs. Smith, it's important that I reiterate that you let us know if you want to move. You have to be really careful if you're moving in your like on your bed, or if you want to get up because you don't want to apply any pressure to your catheter. Okay, and if you're going to sit down, please make sure that you place your urine bag right below your bladder level. Okay, I'm going to go ahead and document my procedure.